Today we will be talking about the respiratory system. We will be talking about its structure, function, age-related risk factors, 3 disorders, and important information for those disorders. First off, we start with the structure. The respiratory system is composed of many structures, such as the nose, nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles, alveoles, diaphragm, and the lungs. As you can see, here's all the labeled areas. Here is the diaphragm, the rib, which is not very far away, the lung. This is an inside view of the lung, and the lung is right here, and here's all the ribs. Here is the trachea, which is the throat, and bronchi and bronchioles. The nasal cavity is an airway, which is lined up with the cilia to trap particles from coming inside. The pharynx is also known as the throat, and it is a passageway for air and food. The larynx is also known as the voice box, which has all our vocal cords. Trachea is a windpipe that carries air into our lungs. Some risk factors into getting a respiratory disease is smoking, air pollution, any allergies that you have. It can also be genetic, and age-related are all risk factors. Smoking both first and second hand are risk factors. Exposure to any irritants can cause disorders like dust, chemicals, any family history of respiratory diseases. Age will include younger kids and older people that have a weaker immune system. And here's also some risk factors, which could be abuse of alcohol, which can damage your lungs, and medical conditions such as chronic obstructive pulmonary disease or asthma, HIV, and AIDS can also affect your respiratory system. And here is a little picture of things that can affect your immune system. The function of the respiratory system. Here is how we are breathing, and here is your whole function. The normal function of the respiratory system is to take oxygen from the air and deliver it into the bloodstream and remove any carbon dioxide or any type of waste particles that are outside, and they are being processed through our breathing. Age-related factors. As people age, their respiratory systems become much more weak, and it changes on them, and it makes it so much difficult to breathe, a lot more difficult. Such as the weakening of their muscles, they get weaker, the air sacs lose shape and elasticity, they have smaller rib cage and are decreased in airflow because of how much older they are. Their body is obviously giving up on them. And here is a picture of an older person where you can see how their lungs are so much smaller, and it's just much more complicated for them to breathe. Another area of an age factor, here's some lungs that are showing here. It is showing how it is increased, it's decreased, muscles mass right here. Here's the lungs. Here are 3 common disorders, which are asthma, which is a condition where a person's airways become inflamed and it becomes narrow and swells up, which causes you to produce extra mucus, which it makes it much more difficult to breathe. And important information for asthma is that it has to be diagnosed. Things to diagnose is that coughs can occur, it's difficult to breathe, there's a lot of wheezing, and there's chest pressure. You can also experience anxiety because of that feeling of that chest pressure. There is also fast heart rate, so increased blood pressure could also be one. They're very common. Usually to treat asthma, you will use an inhaler or oxygen therapy or breathing therapy. Another one is lung cancer. Here is a healthy lung, which is, as you can see, free of all little masses. Then there's an early stage cancer. As you can see, there's masses on here. And then there's late stage cancer, which is filled with a whole bunch of masses where you can see the cancer. It is a cancer that begins in the lungs and most often occurs in people who are smoking. Smoking is not good for you. Lung cancer has to be diagnosed. Usually it's diagnosed immediately. As you can see that you are coughing blood. It is very important to make sure that you are not coughing blood. You can have chest or rib pain and it is frequent. You also get frequent infections. You also have a lot of mucus and it is a lot of discomfort. Treatments are surgery in your lungs, chemotherapy, and self-care such as to stop smoking. There are people that have lung cancer and continue to smoke, which makes it so much worse. And lastly, it is pneumonia. Pneumonia is an infection that infects and inflames the air sacs, which is near the alveoli, the bronchi, and it's fluid in the alveoli. It inflames the air sacs in one or both lungs, which may be filled with fluid. This can also cause death. Pneumonia is diagnosed. It is a cough with phlegm. A person has a lot of fevers or chills and difficulty breathing. They are very dehydrated as well. And you get clammy skin and you are very sweaty. Also a sharp chest pain. Treatments consist of antibiotics, which is the little medicine chart that you have here. And that's it for today. That is the respiratory system. Thank you.